Good morning, everybody, and thanks so much for joining us here on KXAN Live. I'm Will Dupree, coming to you from the KXAN Live studio. As we have for the past few months, we're going to go live now to the Austin Public Health update about COVID-19 and the ongoing vaccination process because there are some updates, particularly regarding booster shots for COVID-19 vaccines. So again, we're going to listen to Dr. Desmar Walks, the health authority for Austin-Travis County, Janet Pichette, as well as Cassie DeLeon, those three different officials providing updates regularly on COVID-19. Let's listen in as this briefing gets underway.
Great day for the fabulous weather here in Austin. Our numbers are going down. We have a 7-day moving average for hospitalizations of 16 and a positivity rate of 5.4. And we're excited that these numbers are continuing to go down. We are even more excited with the news from the CDC and hot off the press guidance from DSHS so that we can start doing booster vaccinations in our clinics here in Travis County and continue to vaccinate our community. We've really had such great success as a community by doing those things that we know work: wearing masks, social distancing, staying home when sick, getting tested, and getting vaccinated. And we really need to continue to do those things in the coming weeks as we anticipate our holiday season, and to continue to get ready for vaccinating our children ages 5 to 11. That's on the horizon. So all of those things make us feel optimistic. And we really want to congratulate the community for everything that it's done to help the team here at APH and all of the healthcare providers deliver the services that we needed to do, get our people who were sick with COVID-19 well, and get those people vaccinated that needed vaccinations. And we need to continue to do those things as we go forward for the holiday season. We're concerned about what's happening to our neighbors in the European nations. We want to make sure that we can have our holiday season with our families and friends in a safe way. If there's not enough space, cover your face. We really want to make sure that people get vaccinated. We want to continue to wear masks in indoor spaces. And all in all, we just look forward to a continuation of the good trend downward of COVID cases. And we hope that you'll continue to do all that it takes to make that happen. And with that, I'll pass it on to Janet.
Thanks, Dr. Walks. Good morning, everyone. As Dr. Walks mentioned, we are seeing cases continue to decline in the Austin area, and that's a very good sign. But just to give us a moment to reflect, over the last 2 months, 2 months ago, our 7-day moving average of new cases was 468, with a 7-day moving average for hospital admissions being 77. Today, we are seeing numbers. We had our 7-day moving average number for new cases is 124, with our 7-day moving average for hospitalizations being, new admissions being 16. So that's a huge, huge improvement. Both of those numbers represent a 70% decline in the number of cases and hospital admissions that we're seeing. And so it's a very good indication that the trend in the community is that numbers are declining. Just to also give you some perspective on where we are on deaths, we have reported a total of 1,148 deaths in Austin and Travis County. If we look back when this outbreak started, in the first 30 reported deaths to Austin and Travis County, the average age of death was 75 years of age, with only 10% of those being people that are 50 years and younger. More recently, if we look at our most recent 30 deaths reported, the average age of death is 58 years of age, which is huge, huge difference. And the number of people that were under the age of 50 were, is 40% in the most recent deaths. with many of those 3 being less than 30 years of age. So I think what this shows is this is a good indicator that vaccines are working in our community. And we know that vaccinations in our older population is fully vaccinated, and we're seeing less that decline in death in that population. But we're also seeing that unless you're vaccinated, the possibility that there is the possibility you could succumb to illness and die at a very early age. So we continue to monitor our trends both locally, nationally, and internationally. As Dr. Walks mentioned, we're very concerned about what's happening in the UK currently, because while they saw a marked decline and decrease in cases from early September, they are now seeing the reverse happening, and that is an increase in the number of cases in a very rapid rise currently. So we're watching and monitoring what's happening there. Sorry, I have someone sneezing in the background. We're watching what's happening there and making sure that we can learn from what's happening as well, because we know that as we see more international events and as we begin to open our communities up and social gatherings occur, that we see that diseases, there's globalization of disease, and disease is just an airplane right away. So we want to monitor that so we keep our community safe. And with that, I'll turn it over to Cassie DeLeon.
Thank you, Janet. And it is great to be here this morning. As Dr. Walks and Janet both talked about, we are in an evolving phase of the response. We're now in stage 2. We are watching those numbers, and we're excited to see that decline. We're also in an evolving phase regarding vaccine. We're seeing new and emerging clinical guidance coming out regarding boosters for Johnson & Johnson and for Moderna vaccine. We are working, as Dr. Walks mentioned, to update our clinical practice guidelines and ensure that we're able to accommodate our community as they come in and seek that vaccine, as well as we're preparing for the pediatric vaccine in anticipation of a newly eligible population within our community that we can provide that protection to. So there's a lot of exciting news there. Considering that, we are looking to invite the community to reflect on the response so far, share their experiences regarding vaccine, and provide us with insights that will really shape how we manage the ongoing response, and particularly how we work through making sure the vaccine efforts that we provide meet the community where they're at and really supports everyone's needs. Our goal is that everyone has access to vaccines, and we need the community's voice to ensure that that happens. So we want to invite folks next week. We will have 2 virtual town hall events on Monday from 6:30 to 8, and on Saturday, October 30th, from 10 to 11:30. So we want to encourage everyone to take part in that opportunity. But also we'll be launching a survey. If you're not able to participate, we'll be launching a community-wide survey as well, because we really do need to hear your feedback. We really want to hear from the community to find out how we can best adjust operations and make sure that we meet your needs. And additionally, now we know that vaccine is really a good solution to fighting COVID. It's also a great solution for fighting the flu. So we want to encourage everyone to think about, this is a good time to, if you're not fully vaccinated or you haven't gotten the COVID vaccine, it's a good time to get vaccinated, because even though we're not in a surge situation, you're still vulnerable from getting this terrible disease. We want to make sure no one has to suffer from this again. So get your vaccine, get your flu shot, so that we can celebrate the holidays fully vaccinated and relaxed. And with that, I'll open us up for questions.
Thank you, Cassie. We will now turn it over to our pool reporter, Olivia Aldridge from Community Impact. Olivia?
Good morning. First question is from us at Community Impact. With children aged 5 to 11 expected to have access to the Pfizer vaccine soon, has Austin Public Health worked with other local providers to ensure that they have the technology and capability to administer that particular dose? Many doctors' offices, for instance, have not offered Pfizer in the past due to its unique storage and preparation.
Yes, we are in planning and collaboration with all of our community partners and talking to them about the new preparation for the 5 to 11-year-old age group that allows for storage in a refrigerator for up to 10 weeks. And we are poised at APH to offer technical assistance. And with that, I'll pass it on to Cassie to give you those details.
Thank you, Dr. Walks. And we are definitely a support for the larger provider community. Austin Public Health provides technical assistance regarding storage and handling of vaccine. We've been talking with our Vaccine for Children providers and the larger pediatric provider network to anticipate what are their concerns and to help them plug into this incredible opportunity to expand vaccine access across our community. If a provider is currently not a registered provider for COVID, we encourage them to reach out to DSHS and get fully registered so that they can be a COVID-19 vaccine provider. And we can also then provide them additional support because if they're looking to have smaller doses of vaccine, we can assist them in providing them access to that as well. So we've got a lot of different ways of providing support to providers that we're working through. And in addition to that, where we know that some of this just isn't appropriate for their clinic setting, we're there to be a space for them to refer their patients to us and to provide them other outlets to refer patients because we want to make sure that they're able to support their patients' needs in the best way possible. And so at this point in time, we just encourage the provider community to come together. We can really stand up and protect these 5 to 11-year-old children and further protect all of our community.
The next question is from CBS Austin. Does approval of the Moderna booster have APH expecting a surge in vaccination demand since many in Austin received the Moderna vaccine, especially from APH? And I would go ahead and add Johnson & Johnson to that as well.
We are expecting that those who've received the Moderna vaccine will be looking for booster doses. However, it's a little bit different now. When we first started vaccine deployment in our community, we were a hub, and now we have numerous vaccine providers in our community. So we anticipate that there will be increased numbers, but the wealth will be spread across the community since we have other providers. But I'll let Cassie add on to that as well.
Thank you, Dr. Walks. And Dr. Walks is absolutely right. When we initially launched Moderna rollout in January of 2021, there was only one location and only one provider. There are so many more providers available, and the community has a lot of choices. And that's exciting because we really want folks to be able to get their vaccine in the space that's close to their home, that's comfortable to them, and that they can, get a time that works for them. But Austin Public Health will also be providing that Moderna booster vaccine. And so if you're looking to make an appointment with Austin Public Health, you can. We also have walk-up locations. So we anticipate that in the coming days, we'll have that operation ready for everyone to get it from Austin Public Health, but you have many, many choices. So we're excited that this is available. And we also want to really stress, if you are in the categories that CDC is recommending to get the booster vaccine, it's really important to look at the timeline and make sure you're following that because we need you to have full protection. This is a big, important tool to help us mitigate our next surge. So everyone needs to make sure that they get that full protection if you are in that category that needs to get vaccinated or that booster.
The next question is from Co-op Radio. In the first year of the pandemic, we saw Brazil overrun with infections and then reinfections as a mutation came back to ravage the same city. Does APH count repeat cases of COVID? And if so, what are they? If not, why not?
Could you repeat the last part of the question?
Does APH count repeat cases of COVID? And if so, I think he's asking how many have there been? And if you don't count them, why not?
Yeah, so I can take that question. So yes, we are currently tracking reinfections for COVID-19 in the Austin Travis County community. And we're also tracking breakthrough cases that we receive information on. You know, based on a new updated report will be released today, but based on last week's reports, we had about 789 reinfections reported to the Austin Public Health Department, and we followed up on those, and then you know, we've had roughly 8,300 breakthrough cases that we've currently identified.
Okay, here's a question from Univision. Flu season is well underway. Have we seen an increase of children being hospitalized, especially with schools being opened?
Hospitalized from flu?
Hospitalized from flu.
Currently, no, we haven't, that I'm aware of, we haven't seen any hospitalizations related to flu in children. We have, again, this is another disease that we do surveillance on. You know, our information is rolled up at a regional level and up to the state level and then onto the national level. But we prepared our first influenza report last week for week 40, which is the first week of the flu season. And the flu, we have seen flu in our community. The numbers have been relatively low currently, with the predominant strain circulating influenza B. So, you know, these are things that we monitor on a routine basis and will continue to do throughout the year. But to my knowledge, we haven't seen any hospitalizations related to flu to date.
And I'd just like to add on that with holidays coming, that we really need to encourage those individuals who are not vaccinated for the flu to go ahead and get vaccinated for the flu. And if unvaccinated for COVID, get that COVID vaccine as well.
And I just want to put a plug in that this Saturday at Travis High School, Austin Public Health is hosting Boo the Flu and COVID too. So we are having a massive flu event that's available for all of our community. And we want to encourage everyone, if you haven't gotten a flu shot, that's one outlet you can go to. And if you need your COVID shot, we'll have COVID vaccine available there as well. And again, flu is available for anyone 6 months and older is recommended. So encourage everyone to get your flu shot so that you're protected from that nasty bug as well.
From KXAN, does the recent FDA approval and widespread availability of booster shots play a role in how soon we could be in stage 2?
We look at a number of factors when we make the decision to move into stage 2. We're currently in stage 3. The main indicator for the change is our 7-day moving average of hospitalizations. But we also look at vaccination rates, and we look at staffing issues. And so it's a lot of consideration of all aspects of the impact of this pandemic on our healthcare and our ability to take care of the community.
With the new eligible populations, age 5 to 11 coming up soon, how does this affect our herd immunity numbers?
With every person that we vaccinate, we improve our herd immunity. And so if we are able to continue with a robust response in our community with people bringing their kids to be vaccinated, we'll be able to improve our herd immunity and protect the community from the spread of COVID-19. And that is going to be very important as we look across the sea to Europe and see that they're now experiencing a surge. We need to continue masking indoors, trying to have activities outdoors when possible. Weather's beautiful, now's the time. Wash hands, stay home when sick, and get tested so that we can continue to keep our numbers down. As Janet said, COVID, change in COVID numbers and spread is impacted by international travel. So it's really important that we do all that we can to vaccinate those who are unvaccinated and protect those who are unvaccinated from severe disease, illness, and hospitalizations and death by masking when we're around them, particularly if you have someone at home who's immunocompromised or unvaccinated.
Okay, here's another question from Co-op Radio. Singapore is a rare entity with very high vaccinations, greater than 84%, very, very strict and enforced protocols, and yet they saw 30% of deaths over the last month being among the fully vaccinated who are over the age of 60. What's the lesson here for APH in our community?
So what the lesson is that we need to protect our vulnerable populations with booster vaccinations, with protecting them by masking when we're around them, so that we don't have any asymptomatic or symptomatic spread of COVID-19 to the population and in and throughout the community. And we also need to remember it's a small world, and if it can happen there, it could happen here. It's a plane ride away. So we need to continue to do what we know works: masking, distancing, washing hands, staying home when sick, testing, and getting vaccinated.
And I'll just add on to that. So I think what it shows is that we need to be ever present and vigilant in what our responses are and ways we protect ourselves. Like Dr. Walk said, masking. If you are going to be doing international travel, if you plan on traveling to visit your family, now it's not the time to throw those public health measures out the window. We need to be vigilant and making sure that we're protecting all those loved ones that we love, so that we can enjoy our time together. And that is, masking, making sure you're vaccinated, especially being mindful about people who are around you and keeping your distance. It could very well be that in Singapore they have a different variant circulating. I don't know, but we do, again, try to monitor that activity that is occurring in other areas of the world to make sure, just like we did at the beginning of COVID, we were monitoring what was happening in China and trying to make sure we were prepared and on the ready. And here we are 2 years later, and we're still fighting this battle. And so now is not the time to give up, but we need to be ever present and vigilant in our response to this disease.
This is our last question, and it's from KXAN. At this point in the pandemic, how much more dangerous and deadly is COVID-19 compared to flu? Are you worried that the flu-vid message will reinforce people's idea that COVID is just like getting the flu?
COVID is much more serious than the flu. Let me be clear. COVID has created a lot of orphan children. There are over 150,000 children that have been reported as having lost a parent or a caregiver as a result of this pandemic. The flu and COVID together, both infections at the same time in one person, is what we're worried about. Because last year we were masking, and this year there's been a relaxation of the use of masks. And that has been our biggest defense against the spread of COVID. With the advent or the beginnings of vaccinations and the spread of vaccination in our community, we look to that as being a protective measure that's going to make a big difference in the holiday season. But we don't want people to get either COVID or the flu, and we certainly don't want them to get both things, because We anticipate that they both have the potential to cause severe illness, COVID more so than the flu. So we're not trying to say that the flu is the same as COVID. We're trying to say, please protect yourselves and try and make yourselves at the least amount of, put yourself in the lowest position of risk, because that's what we're worried about, the risk that's associated with being unvaccinated for the flu and COVID.
And I'll add, just to give people a kind of stark statistic about COVID, likely in 2020, when we get our death and mortality data from the State Health Department, Travis County, the leading cause of death, the third leading cause of death in Travis County will likely be the result of COVID-19. And so to me, it's overcoming unintentional injuries. That's a huge statistic to be reminded of, and the impact, and there are situations here where, it may be just a statistic or a number to you, but I guarantee to some people, this is not just a number. This is somebody's family member who's passed away. I know numerous people who've either succumbed to this illness in some form or fashion, some prior to when vaccine was available, some after vaccine has been available. And it's sad. It's sad when I hear these stories on a day-to-day basis. It's mentally anguishing for me, let alone for those family members who are touched by it. So, it's deadly. Flu is deadly. These things are bad, and the very sad thing about it is these are preventable illnesses that can be prevented through using these precautionary public health measures that have always worked throughout the course of time, but also we have vaccine available and tools in our pocket that can make this make our community safe, and we need to continue to be vigilant in putting in place those prevention measures.
Thank you, Janet. That ends our question portion. We will now move into our closing remarks. Dr. Walks.
We're in stage 3. Our case numbers are low. We're anticipating holiday revelry and Halloween goblins and trick-or-treaters, and we want to keep this community on the right track to enjoy those things. We have to continue getting vaccinated. It is true that boosters have been approved and we're ready to give those boosters, but for anyone who's unvaccinated, I urge you to get vaccinated. For those that are at the point where they are eligible for boosters, 2 months after the J&J, 6 months after the mRNA, Pfizer, Moderna vaccines, go and get your booster shots. There are several vaccine providers in our community, and we at APH are ready to go. The team is ready. The pediatric vaccines for the 5 to 11-year-olds are on the way. Approval is on the horizon, and we are ready to help our partners in any way that we can, and we have vaccine clinics ready to go and plans. It's important to protect yourself from COVID. It is a serious illness. As Janet said, the statistics are startling and heartbreaking. It's important to protect yourself from getting the flu. It is important that we stay the course. Other countries are seeing surges right now. We are in a time of relative calm. It's important that we remain vigilant. It's important to keep masking, washing hands, staying home when sick, getting tested, and getting your vaccine. I urge you, if you're having celebrations with friends and loved ones, that you know who's going to be there. Wear a mask if you think that there's going to be someone there who is at risk of becoming sick because they're immune compromised or unvaccinated. If you're not sure that the sniffle you have is COVID, go get tested. I ask you all to continue to do what this community does best, work together to end the spread of COVID-19. And with that, I'll pass it on to Janet.
Thanks, Dr. Watts. And again, I just would like for the Austin Travis County community to recognize that we are in good space right now. We have every indication, we have good indicators showing that we have declining numbers of cases, as Dr. Watts has mentioned, and we'd like to keep it that way. And one way in doing so is to make absolutely sure that we, as she mentioned, are doing and putting into place those prevention measures that we know work, fighting not only COVID, but also the flu. And that's the masking and getting vaccinated. It's crucially important for us to continue to be vigilant and protect ourselves and our community. If you do plan on having a holiday coming up and you plan on traveling places, make sure you have vaccine on board, make sure you have your mask with you, because while you may be vigilant, others may not be, but make sure that you're protecting yourself and socially distancing and things like that. Again, we are tracking things. We're seeing positive indicators that things are dropping, and we don't want to see or learn from the United Kingdom that we could have done something to prevent it, since they are seeing increases there, and we'll be monitoring what is happening there so that we don't have a similar pattern occur here in our local community. But again, enjoy. I would say, we have our opening up gatherings where, we had ACL, we have Formula One this weekend. It's going to be a beautiful weekend. People get out there, enjoy Austin. Our visitors enjoy Austin, but please do it in a safe manner. And I will turn it over to Cassie to wrap us up.
Thank you. Just to reiterate, we are excited in the spot that we're in, but we can't get complacent. We do not want to return to the experience we were just having just a few weeks ago. That is a dangerous spot for us, not just regarding COVID, but for everything that we're at risk for. Not having the hospital capacity to support all of our just basic regular hospitalization needs that we have is very concerning. So as a community, we have to really band together to make sure that we are protecting each other and we're practicing those safety measures so that we can ensure that we keep COVID at bay. It is something we have to think about daily now. It is something we have to integrate into how we go out and we go to the grocery store and be mindful of what do we need to do? When do we need to have hand sanitizer ready? When do we need to have our masks available and ready to put on? And as we're doing that, thinking about, am I due for my vaccine? Is it time for my booster? When was my last vaccine? And so now that Moderna, we know a lot of our community was vaccinated with Moderna. That was our initial rollout, and most of the allocations we had were Moderna vaccine. Many of you, it's important to check your vaccine card because you're going to be due that booster dose. And so want to look at that, get a plan together to get your Moderna vaccine, get your, and if you're not fully vaccinated, get fully vaccinated and get your flu shot. And if you're a parent of a 5 to 11-year-old, this is a real opportunity to talk with your pediatrician, find out if they're going to be providing the vaccine. And if not, there are many, many locations that are safe and comfortable spaces for your child to get vaccinated. We're working with schools. We're working with a lot of different locations so that as a family, you can make that personal health decision to get your children vaccinated and ensure that they have that protection as well. Everyone that's vaccinated, it's a multiplier effect. They're protecting themselves, but you're also protecting the rest of your family and everyone else in the community. So we really want to encourage that, along with flu, to encourage getting the flu vaccine too. So we can roll into the holidays, Halloween, Thanksgiving, the December Christmas holidays, and other holidays that we all want to celebrate and be together as a family. We want to have those vaccines and be able to relax and enjoy each other's company. And with that, have a safe and healthy weekend.
Thank you. That concludes our media availability for today. Thank you to Dr. Desmar Walks, Chief Epidemiologist Janet Pichette, Cassandra De Leon, APH Chief Administrative Officer for Disease Prevention Health Promotion Division, and to our pool reporter, Olivia Aldridge from Community Impact. Thanks for joining us, and have a safe weekend.
Hey there, everybody. Again, Will Dupree in the KXAN Live studio. Thanks for sticking with us as we've brought you that Austin Public Health briefing about COVID-19. Some encouraging numbers to share at the beginning, saying that we are seeing still a downward trend in new hospital admissions and even in case numbers. Very different situations than we were in earlier, just about a month ago or so. So we are still in stage 3, as the graphic on your screen tells you at the bottom there. And I wanted to show you kind of where we are at the moment. So Austin Public Health shares this graph, which tracks some of the different indicators they use and some of the data points they use to influence where we fall. And if you notice right there, there have been 3 peaks throughout the pandemic. We are on the downslide of the 3rd one, and you might be able to kind of see there on the far right-hand side of the graph that we are still sitting at the very bottom of the stage 3 level. And some of the things that have been influencing that are the new admissions for 7-day moving average. That's on the left side of the screen there. That's 16. We need to sustain ourselves and get that number to between 5 and 14 for a considerable period of time for us to move into stage 2. We're not there yet, but we are moving towards it. Again, case numbers are down, hospital admissions are down as well. Again, encouraging signs there. There was much talk today about availability of booster shots after the FDA and CDC gave approval to vaccine boosters for all the vaccines available, Pfizer, Moderna, and Johnson & Johnson. So if you're wondering out there, what's the advisement for these particular shots, I want to show you really quickly. Here are the recommendations from the CDC about COVID-19 boosters. Now, if you have gotten the Pfizer or Moderna shots, here's the information to know. You can get a booster 6 months after receiving your vaccine. And the people who are eligible are those 65 and older and adults 18 and older who live in long-term care settings, have underlying medical conditions, or work and live in high-risk settings. I'm going to leave this up really quickly so that if you have gotten the Pfizer or Moderna vaccine, here's the information available to when you can get a booster dose. There is mixing and matching available, and that really plays into the effect for those who have gotten the Johnson & Johnson 1-dose shot. For a booster, if you've gotten the Johnson & Johnson vaccine, you are eligible to receive the booster of any kind, Pfizer, Moderna, or Johnson & Johnson, 2 months after that initial shot. So this is the information that was just shared this week, coming to us, and Austin Public Health is advising people out there to make a plan. Look at your vaccine card, see when the date was that you got that last shot, and if you are falling to that particular time period, you can go and get the booster shot. Austin Public Health is making plans right now to provide appointments so that people can get the Moderna booster shot from Austin Public Health. We will keep tracking on information about that and see when those appointments become available. However, there are lots of providers available in our community. I do want to point out that if you have questions about which vaccine providers are out there, take a look here. The Texas Department of State Health Services has a website specifically designated for COVID-19 vaccination information. Again, that's dshs.texas.gov/COVID vaccine. If you go to this website, you can find that vaccines are available to be able to locate and see which ones are closest to you right here. One of the best ways to look is the National Vaccine Finder. That's vaccines.gov, the website run through the CDC. You can enter your information and find out where those are closest to you. Austin Public Health also provides this kind of information, so you can check out their website. We are working to compile everything that was shared today during this briefing in our story on our website right now. That's at kxan.com and on the KXAN News app. We also found out recently how many cases have been linked back to Austin city limits. Of course, that is one of the largest gatherings we've had here in the city. And on that story on our website, you can find out just how many cases were linked to that really big music festival. And it's a pretty low numbers, which is a good indication that some of those prevention measures that the event took and the city organized with them really did work. Thanks again, everybody, for joining us here today. Hope you enjoy the rest of your Friday. I'm Will Dupree in the KXAN Live studio. We'll see you back here another time. Please, everybody, stay safe and healthy out there, and take care.